is that the capital markets don't necessarily support a shift from therapy to diagnosis, or would you say detection? Detection.
And honestly, you're describing right now the market failure.
The market failure.
Okay,
I'm
keep going,
describing
sorry, I'm catching up.
the market failure exists not because of bad actors, but because of history of where the market was in its incremental growth. But it has all of us. This is where we got with Greg. It has suddenly shifted dramatically from volume to value, where curing actually creates money for the health system and actors. A. B. The cost of the technologies the underlying technologies and miniaturization, all the exponentials dropped dramatically. And the capacity for anyone to prove that their technology can be applied and be made useful just decreased suddenly. So in one massive moment, we have the opportunity to take the market shift and to apply it against all of these patients.
Can I ask you a clarifying question? Okay, so I'm kind of... The market shift that you're describing suggests that market failure isn't a problem.
No, it suggests that that previous companies, financial systems, banks and institutions are all geared from literally 100-year tradition against a different market.
So if that's the case,
and we're going to reinvent an entire market with one game.
Does our rationale for why to bring these people together for this competition is it still valid?
Oh yeah, because
Because part of the story we've been telling is the ecosystem is fundamentally broken, the regulatory line is long, you don't have access to samples and data and capital and
all correct.
Okay.
All correct. Okay, so let me try to reframe it just slightly. All of those things are outputs of a market that was made before, over a 100-year tradition, where therapeutics became the most highly profitable businesses, right? That's where you made the most amount of money. Capital markets moved you in that direction. It became profitable to treat as opposed to prevent.
Okay.
That's clear.
Yep.
Markets are shifting where prevention and cure can become incredibly valuable, right? Volume to value.
Okay.
We're not paying for an episode, we're paying for overall cost.
Yep.
Okay. Irrespective, we know now, today, we have an explosion of abundance of technical options to diagnose or detect. We didn't have an explosion. Each of the underlying technologies, each of them has gone through an explosion of capability. The miniaturization of componentry, the massive explosion of computing power, the massive decrease of storage, bandwidth, machine learning, Internet of Things. It's just unique in this particular space. And yeah.
No, it's interesting. And as I'm thinking about it, there's one that hasn't, and that's the clinical trial sample data. But anyway, that's just something that just popped in my head.
Well, that's why our prize exists the way
exactly,
it does.
Exactly.
So it's not the issue of invention we're solving. It's the issue of transmuting invention into solution that's the problem. And that's an incredibly challenging one, because that old market that we just talked about is what we're solving. We're creating the domino to change all the market forces by showing that this market can be highly profitable.
So does the ecosystem that we are predicating our value on, bringing together, still hold?
Yeah, because it's the ecosystem you need for tomorrow's healthcare today.
Okay.
And they all exist. We are bringing them together because they provide the unique aspects of the solution that are truly the moonshot.
So we're talking, Greg had mentioned, like, you always try to trade off cost, schedule, performance, my words, and by the way, I agree with him. In gaming, effectively what you're always trying to do is accelerate, and I'll turn the words around. You're trying to accelerate, you're trying to expedite, you're trying to expand, right? You're trying to solve at a scale and a pace that the world doesn't really allow you for.
So what you're telling us right now, the story is simply, and I really like it. For decades, for a century, the market has focused on treating whatever you find reactively by happenstance. Whatever you find by happenstance, treating it reactively. And all, right? So that's where we are. So if you just happen to have
No,
a
I would
pain
say
and you
reactive.
get, and
Remove the
somebody,
word reactive and we're on
yeah,
the same page.
it's
You're
happen-
treating.
Yeah, you're treating. You're basically treating whatever you happen to find. So if somebody comes in and says, I have a pain here, and they look it up, what it is, and you get whatever, and it gets diagnosed as cancer, then you treat it. But, and then we're shifting, however, what we're trying to accomplish is a shift to a market where we are focusing on early detection. I'm still not totally tracking what we're trying. What's the established market we're trying to disrupt and shift? I guess.
Okay.
We need to describe that clearly.
Capital access.
Mm-hmm.
The process of proving and developing and scaling diagnostics or detection solutions.
Mm-hmm.
And those are the three. I don't think there's another. I think those are the three things that we're trying to solve. People would say, why don't pharma, remember you guys were saying, why don't pharma companies, well, the pharma companies are pharma companies, they're not diagnostic companies. There's a whole market tuned to go to great therapeutics. It's a and there's an easy stat. If you add up all the diagnostic companies and add up all the pharmaceutical therapeutic companies, maybe a factor of 50 in terms of size. You should do that. You should say that this is how the markets have biased into treatment, and it's not without good reason. Something has changed suddenly. We are changing the way we are reimbursing, particularly in the United States. We are transforming the opportunities for treatment because we have a lot out of there. And most importantly, the capacity to prove that a technology works has suddenly shifted from what used to take or could have taken many, many, many years to possibly months.
Okay, so Asif, in what you're describing then, there is some tweaks that I'd suggest we need to make. Because what we would do, and by the way, I think this goes to the exponentials and all those components that we want to score, is that, and John, jump in where you'd want on this, is that we have a design right now that's going to rapidly accelerate the ability to solve and solution for detection capability through an expedited ecosystem, blah, blah, blah. All good. I think we now have some levers to twist on this thing such that the takeaway from the prize is not only the throughput of those solutions, is the maturation of that market.
Yeah.
So we want
the point of the prize isn't to create a single solution. The point of the prize is to change everything.
But I think you.
I love that. So can I just tag in real quick?
Yeah.
The reason I stepped out was to call back the CEO of American Film Institute, who's trying to help us get our celebrity.
Yeah.
He's fantastic. Jim Moffat's on the board, and he's trying to help us understand Hollywood and how to write a compelling letter, and he's going to work us through the system. And we sent him a letter, and he was like, Beth, I'm going to break it down for you. Too long, too complex. He was like, your first line needs to say, this now for the letter, which is going to be different, but the takeaways are the same. He said the first line needs to be, I'm in. And you saying those two words could make a big difference on X amount of people's lives.
Could save 4 million lives a year.
Yes, and he said, I don't want to hear about the ovarian cancer thing. Nobody's going to read it. Nobody gets it. And so I think we have to understand that the scientific rigor that we needed to make sure that this and all of this makes sense, we have to shift the. I didn't want to slow you down, but he's like, I don't get it. I'm willing to support you. You need to make it very simple.
Yeah, and I think the simplicity is we now have the moment in time in history to prevent up to 4 million people from dying and suffering every year.
Yes.
And the reason why is that we have the capacity to take the abundance of exponential technologies, and we should list some of them out, like computing power, miniaturization, Internet of Things, monitoring, machine learning,
Yes.
robotics, et cetera, et cetera.
Yeah.
They are all transforming in every aspect, but they all apply
Yep.
to early detection.
Yes.
The problem is not invention. The problem is creating a healthcare solution, and no one's responsible for doing it today, but you can change it.
And that's it. Like what you just said, look at him. That was good.
So Asif, in your own words, why a prize?
Because there's absolutely no actor responsible for changing the market to prevent all the lives that are being lost and all the family members that are suffering, though we have an abundance of technology, an explosion of data to prove that certain technologies can work, and relevant parties like the regulators as well as health institutions that are actively trying to gain access to those technologies. The whole market's ready to do it, but there's no convener, and the government's not the responsible party to move capital dollars and to reshape the way the commercial markets work.
Okay.
We are.
Other devil's advocate, but there's already billions of dollars flowing into cancer.
It's
why,
not the
why
money.
more?
It's not the money. We don't need the money. You're talking about a multi-$100 billion market. That's not the problem. The market is not us replacing the capital markets. The difference is us changing everything. It's changing the fundamentals of the way solutions are created in healthcare, which require a prize. Just like if you wanted to go to outer space, you need all the componentries to work together in a different way. In healthcare, you need the same.
I'm intentionally hammering
I know,
on that
that was good.
because I'm doing the X Prize.
Good.
Devil's
Yeah,
advocate
that's what we're
involved.
saying.
And I have two
Right,
devil
so-
advocates too.
And I mean, we're answering. I
Yes,
think
Counselor.
we're beginning to hone in. I love it how we're honing in. Our challenge will be we have to make it easy, to Beth's point, but we can't dumb it down too much that people will say, "Oh, cancer again," you know, right?
We're not dumbing it down.
No,
I'm
but
sorry.
I'm just saying.
He's right.
I'm
He's right.
just saying we need to be super careful. We're not dumbing it down to the point that people only hear cancer. I hear it every day. Next, please. You know.
Well, and you could, and one way of saying it, the issue isn't cancer. The issue is abundance. We are in a situation where we can create mass abundance in our lives if we do a couple small things together.
Yes.
And it's the issue of doing it together that's different.
Okay, so then
Can I
then,
just tag in real quick?
Okay.
Bob
you
from
in a second.
AFI said selling about wanting to be on a winning team is an important thing. So that is something that we need to extrapolate. Because like this guy, he basically, this is the notes from that call. Bob represents all of these big name actors, or he's the nonprofit
Yeah.
that supports them. He knows the messages they want to hear. He was like, it's gotta be more clear, it's gotta be personalized, and people want to be on a winning team.
Okay, but they're not only actors in the
I was
audience.
gonna say,
But
I mean,
I mean,
Well,
let me say
no,
my
but
second.
this is the voice.
You have to understand that right now, our issue is not that we're not specific enough.
I know.
Our issue.
Totally understand.
So just trust me. If we overcorrect, we can then still come down.
Yeah,
or we-
no.
Okay.
I want to say my second point though.
All right.
Second challenge, X Prize. All right. Understand what you're saying. Those guys over there who want to have drinking water for the whole world, if they don't even have any dollars in their field, if they don't get an X Prize, then nothing will happen in their end, and they're saving just as many millions of lives with that.
Yeah,
So
and
why should we vote
Right.
for you over them?
Right. And well, that's a really hard thing to do.
Well,
I'm
Do they
water.
have to?
I mean, that's
do they
the
have
right,
to-
so- but that's
for
what
a
I'm
marketing?
against.
What's
Part of
your
the
shirt?
problem. I know what I mean. I got suspenders on, so I'm like.
Do they have to do both? I mean, isn't just a matter of
We
convincing?
can do both.
They
So-
can do both,
They-
yes,
they-
but
they
your
can do,
point's
but
well
let me
taken.
answer the question. Let me try to answer the question. Okay. In the unique case of cancer, unlike other areas like clean water, where invention might be the issue. Our opportunity is so in our face. Well, I'm trying to figure out.
I know, this
I
is
like
it.
where you're
Keep
going. I like
keep
The different. I'm trying. I saw the analogy in my head, which was a bursting like bank of water,
Yeah,
where it's because of the water thing.
Yeah.
We're
We got it the first time.
literally at the precipice of an incredible, massive shift in opportunity and abundance.
Capture some.
Right?
Yeah, he's
Where, unlike in water, where there hasn't been the fundamentals of radical change in every componentry and part of the system, we have it in cancer. And we have the opportunity to tie it all together. You have the government launching a moonshot, you have suitable regulators, you have every componentry of the technology that just got millions of times cheaper.
so you're saying the time is now.
The time is now.
So
Go
my
solve water next year.
So my three questions simply put are, why cancer
Time is
and
now.
not water?
Yeah.
Why no, you lost me when you just had it.
Why can't
Why
Why
not?
cancer
Why not?
and not something else, right? Why now and
Why
not
X
not
Prize?
tomorrow? And why an X Prize? Exactly, that was my
Okay.
favorite. Thanks for
Now the
that.
X Prize is the
Why
easiest thing to
X Prize?
solve.
Yeah.
And that's what we don't spend enough time. The wonderful game you came up with is the reason why you need an X Prize. And when we were talking to Greg, it was very straightforward that it's not the government's responsibility to engineer a capital market to throw billions of dollars into the diagnostic field. It's their responsibility to create good science, to be a good regulator, and to create policy. They've created a suitable environment for massive breakthroughs. Okay, it's not the doctor's responsibility, it's not the diagnostics responsibility, it's not the inventor's responsibility to create a market, it is ours, meaning X Prize.
Mhm.
It is a prize that is required to reshape everything. The problem is, unless you change everything, you don't get the type of abundance of millions of lives and the decrease in suffering. You don't get a world that could be tomorrow in 30 years happening immediately. What you do get is you get a 1930s technology that gets deployed in 40 years that's still used 65 years later.
Yeah.
So if you want to let a market continue its normal growth, you might have technologies in 20 and 30 years. But if you want all of them available to you in the next 5, you need a prize.
Okay, let me jump
Yeah,
in.
but so just to summarize quickly, I'm sorry. So
You can't
why
jump in.
It's
cancer?
impossible.
Because in your face,
It's like a tennis.
over water, in your face, it's right there. It's waiting for somebody to do something about it. Everything is there in place. Just somebody needs. Why X Prize? Because that is the key that will unlock all that. And why now? Because in that hour that we just talked, another 500 people died unnecessarily. Or I mean, however you want to put it. But what's
the
the
why now could
right?
also be the confluence of all the forces
Yeah,
that have
the
been
market is
discussed.
right.
Yes.
Right, so
The
Oh,
thing
but
I
that's
can't
the
sim-
that's the why
The
cancer.
thing I
also, right,
can't
in your
simplify
face.
is cancer itself.
Yeah.
Cancer itself is inherently complex and requires an incredibly complex series of technologies and stakeholders to act. The only difference is they all exploded in the last 4 years, all of them. Genomics, science, the types of therapies available, the economic markets and market forces, the
Technology.
underlying technology of computing and computational
Yes.
sciences and miniaturizations of solutions. The opportunity is now. It wasn't 3 years ago, and it won't be in 10 years. Water will always be a problem.
Just really quickly.
Oh my God!
Because that's part of the why cancer. It's not easy. It's not like you have to show that it's not super easy, but the market is primed right now, so we got to act on it. Because if it's not like you just put a key in a hole and you turn it, because you can do it anytime, it's still very challenging. So we just don't want to lose that first part in the.
Don't
data
lose the word
exploded, it's
revolution.
now.
Two things,
Yes.
devil's
for
advocate,
it.
so to speak, but actually not really. One is the part about the nanotechnology, the bandwidth, the computing power, etc. I think is a true statement as to why we're where we are. Given X Prize's DNA, let's be cautious about not saying that we don't want to stifle the inventions part using those levers of advancement. So someone could still advance the ball in a way using
Well,
those.
is it, okay, so there's a difference, and this is what we talked about when you and Beth stepped out. There's a difference between invention and innovation,
That's fair.
right?
That's fair.
Okay,
The issue in cancer is not invention, is innovation.
That's a fair,
But
that's
are we
consistent.
willing, is it okay to
Yeah,
say that?
that's consistent.
Okay.
Yeah. We
And-
want to attract the innovation. That's
The
it.
underlying technologies have been invented. The solutions have not been innovated.
That's fair. That's fair. But that's
Oh,
what
I like that.
That's what I want to make sure we
Did
have
you
the
get
right
that?
I
vernacular.
did. Dr. Dar, I have a question for
Well,
you.
hold on. I got to. And then the second question is, as we move, in very quick analogy, let's go back to the first prize, which was the Lindbergh flying. It's not about getting over to Paris. It's about inventing commercial air travel, right? That's what we're effectively saying here.
Yes.
The prize that gets through this, so the kid wins 20, or whoever wins the $20 million, is to generate a transformation, a revolution of the market.
yeah.
Yes.
That thing in and
That's
of
right.
itself
That's
is
just as important as
right.
that.
It is what it is, but we got to go. The market has to never go back to what it was after we do, so to
A
speak.
market
A
revolution.
market revolution. So we've got to make sure that as we build that ecosystem, they're not only so conducive to the kid, my words, winning the $20 million, they are a learning mechanism so that when they come back to being, it's now facilitating the kind of future
We have
want.
very strong
We have
evidence
to change that.
that market shift in healthcare, when you prove that a type of technology or approach to creating something actually works. It works at scale. The problem in healthcare is you may have tons and tons of portfolios of compounds and medical underlying technologies, et cetera, et cetera. No one cares until somebody's life is saved. And that's what we have to do with this prize. And that's why the prize exists. Once we can show it can save all these people's lives, hold on, because there'll be a flood. It'll be like you'll need an ark to get through this one. I mean, but that's effectively what Andrew, I believe, was trying to say. A little long-winded, but you said it. That effectively, we need to prove that the technology works. That's why you need a prize.
Okay. So
Because in
last one.
healthcare, nothing changes.
Last one.
Go for it.
There had been a school of thought we've been discussing, which was after the prize winner gets to, they failed tested and they're a proof point and they get their money, that conceivably at that point in time, that's where you'd see quote unquote capital come to take them to market. What I think I'm hearing is we don't care, although there may be an instance of capital coming to take that to market, we actually want to change the market so that this now is the norm
So
for
don't
it.
fall into the trap, John, of saying we have to change the market. Fall into the trap to say the market will change.
That's right.
It's just the way capital markets work. They work to where the return on investments are highest. And if you radically decrease the cost of development and you radically decrease the time to get to market, you radically decrease the adoption cycle, the likelihood of you making money increases almost exponentially. And that's the nature of our prize. We've taken 3 portions, which are very lengthy, and we've radically shortened them with small interventions. So we've facilitated the ability to do this. That's it. And that's why our particular prize approach is so very useful. And guess what? It creates longevity that approach will always exist in the rest of the market. And you don't have to believe it, it's what the vice president and the entire Moonshot Blue Ribbon panel has come up with. We're just gonna go do it.
I'm gonna jump in.
Yeah. You ready?
I think the answer of why not water is about the market. Because solving water is a distribution of the technology problem. So we know how to filter water. We do it every single day. We drink filtered water. The challenge there is distribution. And prizes aren't very good at incenting distribution, as Audrey and I know. They're very good at capturing a market that's sort of at the tipping point of needing that. At $20 million, I didn't want to say it when the folks are on the phone.
It's not.
That means nothing to nobody. Maybe to John when he writes creates the technology. But
Yeah.
we interviewed 20 big pharma companies for our $30 million prize. They laughed.
Yeah.
It's like 30 million is a rounding error when you're doing
Okay.
R&D.
Yep.
But you have to. I think one area you guys are entirely clear in your pitches. Does the market exist already? Or is the market requiring capital, cash flow?
No, the market exists.
What we proved in our vaccine prizes, there's a $400 million market already. If you can turn the vaccine to something that's, you know, approved by the EU in this case, there's a $400 million market waiting for you. So I think what I haven't heard you guys talk about is, if I have a diagnostic that, I'm not a scientist, so, you know.
I'll give you proof. I'll give you proof point.
So it's, here's what you're basically unleashing to whoever the solver is.
So we were talking to CureSearch and Laura Thrall, and there's a very famous story. Solutions aren't created for children in healthcare. It's really sad because there's such small populations. There's the capital markets don't move. So she had a simple thing to say, oh, let's make it really cheap. And no one believed it until actually somebody did it. They said, give us access to everybody's portfolios and libraries. Let's give access to everybody's biomarkers or signatures, and we'll match them up and we'll try them. Somebody did it. And actually, it was just bought by Genentech for $200 million. There's no problem with the capital market. There's a problem with proving something works.
Right.
And that's what I really think we need to anchor our prize around. There's not a problem with the capital markets. People like making money, right? There's no problem with curing people. People like people being cured, right? There's actually not a real issue with the FDA. They'll help. There's an issue by showing it works.
Yeah.
That everyone knows it works. We have all the technologies. We can match the technologies to the clinical scenarios and show it works. When you show it works, money comes in. Kind of.
So I think the question then is, how does the prize help that it proves that it works
That's a good point.
faster than the normal market would take?
Well, I'll tell you. So I'll give you my own experience, right? So I got bored at Booz Allen. I never told you guys this. So when I left, I said I'm going to go invent my own company, and I asked my and keep the stop this for a second.